Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case report published in the Journal of Veterinary Internal Medicine in 2024. This report, authored by Argyrios Genoudis and colleagues from various institutions across Europe, explores an unusual situation encountered in a domestic short-haired cat. The case highlights a discordance between the cat's blood type as determined by standard laboratory tests and its underlying genetic makeup. This intriguing finding has potential implications for blood transfusions and our understanding of feline blood groups. The major feline blood group system categorizes cats into three main types, A, B, and a less common type C, also known as AB. These blood types are significant because cats naturally produce antibodies against blood types they do not possess. For instance, most type B cats older than 3 months have naturally occurring anti-A antibodies. If a type B cat receives type A blood, this can trigger a life-threatening acute hemolytic reaction. Similarly, this incompatibility can lead to neonatal isoerythrolysis, a condition affecting newborn kittens. The prevalence of these blood types varies geographically and among different cat breeds, with type A generally being the most common. The specific antigens that define these blood types reside on the surface of red blood cells. For type A blood, the key determinant is N-glycosylneuramic acid, often abbreviated as NuGC. In contrast, type B blood is characterized by N-acetylneuramic acid, or NuAC. The genetic basis for these differences lies in variations of the gene that encodes an enzyme called cytidine monophospho-N-acetylneuramic acid hydroxylase, often shortened to CMAH. This enzyme is responsible for converting NuAC to NuGC. Consequently, type B cats primarily express NuAC, while type A cats predominantly have NuGC. Type C cats exhibit roughly equal amounts of both NuAC and NuGC on their red blood cell membranes. In the realm of human blood groups, specifically the ABO system, there exists a very rare condition known as the Bombay blood group phenotype. This blood type is exceptionally uncommon outside of Southeast Asia, occurring in approximately 1 in a million individuals in Europe. The defining characteristic of the Bombay phenotype is the absence of the H antigen on red blood cells. The H antigen serves as a foundation upon which the A and B antigens are built. Therefore, individuals lacking the H antigen are unable to produce either A or B antigens. When routine ABO blood typing is performed, these individuals appear as type O, regardless of their actual ABO genes. Furthermore, people with the Bombay phenotype produce antibodies against both A and B antigens, and also a clinically significant level of anti-H antibodies. Consequently, they can only receive blood from other individuals with the Bombay phenotype, meaning H antigen-negative blood. This case report describes a domestic short-haired cat that presented with blood type characteristics that resembled this exceedingly rare Bombay phenotype or potentially a weak type B blood type. Let's delve into the details of this unusual case. The subject of this report was a 4.5-year-old neutered male domestic short-haired cat. The cat was brought to the companion animal clinic at the School of Veterinary Medicine, Aristotle University of Thessaloniki in Greece. The cat had a 3-week history of worsening anorexia, lethargy, bad breath, and vomiting. Upon physical examination, the cat was in poor body condition, exhibited moderate paleness, was lethargic, had ulcerative lesions on its tongue, and a heart murmur. Initial laboratory tests, including a complete blood count and blood smear examination, revealed a non-regenerative anemia, meaning the bone marrow was not adequately producing new red blood cells to compensate for the loss. The cat also had an elevated white blood cell count, specifically neutrophils, indicating inflammation or infection, and a reduced platelet count. A serum biochemistry panel showed markedly increased levels of creatinine, urea nitrogen, and inorganic phosphorus, all indicative of significant kidney dysfunction. Urinalysis further supported the diagnosis of kidney disease. Importantly, the cat tested positive for feline leukemia virus antigen and negative for feline immunodeficiency virus antibodies. Abdominal ultrasound confirmed abnormalities in the left kidney consistent with chronic kidney disease. Due to the severity of the likely chronic kidney disease, the cat was hospitalized. Serial blood tests showed a worsening of the anemia, necessitating a blood transfusion. At this point, in-clinic blood typing was performed using an immunochromatographic strip assay. Surprisingly, no distinct A or B bands appeared on the test strip, while the control band, indicating the test was working, was clearly visible. This blood typing was attempted 2 more times with the same assay, including once with concentrated red blood cells, but the results remained the same. This lack of A or B band was unexpected, as a type O within the feline ABC system had not been previously documented. To investigate further, a glass slide back typing was performed by mixing the cat's serum with known type A red blood cells. Gross agglutination, or clumping of the red blood cells, was observed. This suggested that the recipient cat's blood contained antibodies against type A red blood cells, implying the cat might be type B. However, a type B blood unit was not immediately available, so a transfusion was not performed at that time. The cat was treated with supportive care, but its condition continued to decline, leading to euthanasia 1 month after admission. Permission for a post-mortem examination was not granted. Given the unusual blood typing results, leftover blood samples were sent to the manufacturer of the immunochromatographic strip assay for further analysis. Tests using different batches of the assay also failed to identify the cat's blood type as A or B. Major and minor cross-matching tests were then conducted using a gel column system. The recipient's plasma caused agglutination when mixed with red blood cells from both type A and type B donor cats. Conversely, when the recipient's red blood cells were mixed with plasma from 2 type B cats, no agglutination was observed, indicating compatibility. However, when the recipient's red blood cells were mixed with plasma from 2 type A cats, one showed no agglutination compatible, while the other showed agglutination incompatible. To determine the levels of anti-A and anti-B antibodies, the recipient's plasma was serially diluted and tested against red blood cells from 2 different type A and 2 different type B donor cats. These titration experiments revealed anti-A antibodies were present up to a dilution of 1/32, and anti-B antibodies were present up to a dilution of 1/4. Finally, genetic analysis was performed on the cat's blood to identify variations in the CMAH gene. This genotyping revealed that the cat was homozygous for the C.179G greater than T CMAH variant, a genetic change known to predict a blood type B. The findings of this case report describe a cat where standard in-clinic blood typing failed to identify the ABC blood group antigens on its red blood cells. Despite this, the cat's genetic analysis confirmed it possessed the genetic variant typically associated with blood type B. This discordance between the phenotype, what the tests show, and the genotype, the genetic makeup, is the central point of this report. The identified CMAH variant, C.179G greater than T, is known to result in blood type B in Turkish domestic cats and other breeds, making its presence in a Greek domestic short-haired cat not entirely unexpected given the geographical proximity. However, this genotype should have resulted in a detectable type B phenotype using the immunochromatographic strip assay, which was not the case. The repeated failure of the assay, even with concentrated red blood cells, suggests a genuine absence or very weak expression of both new AC, type B antigen, and new GC, type A antigen. This is further supported by the presence of detectable anti-A and anti-B antibodies in the cat's plasma. The observation that neither new AC nor new GC seem to be readily detectable, coupled with a mutated CMAH enzyme, raises the possibility that the enzyme might be altered in such a way that it produces a different precursor antigen, distinct from the typical A or B antigens. Overall, the blood type characteristics observed in this cat bear similarities to either an unusual weak B phenotype or the exceedingly rare Bombay-like phenotype seen in the human ABO blood group system. However, it is important to note that a precursor substrate analogous to the H antigen in the human ABO system has not yet been identified in cats. In humans with the Bombay phenotype, routine ABO blood typing results in a type O designation because they lack the H antigen, which is necessary for the formation of A and B antigens. Consequently, their red blood cells do not react with anti-A or anti-B reagents. However, they do produce antibodies against A and B red blood cell antigens, as well as anti-H antibodies. Individuals with this rare phenotype can only receive H antigen-negative blood. In the case of this cat, testing for a potential precursor substrate was not technically possible. In human medicine, uncommon blood type variants include weak A and B subgroups. Individuals with these phenotypes have reduced levels of A or B antigens on their red blood cells, leading to variable reactions with standard anti-A or anti-B antibodies. It has been proposed that variations in the regulatory region of the ABO gene might cause weak blood group B phenotypes. Interestingly, a small percentage of individuals with weak A or B subgroups can have anti-A or anti-B antibodies in their plasma, similar to what was observed in the cat of this report. While discrepancies between blood type, genotype, and phenotype are rarely reported in cats, previous cases have not been identical to this one. Recent research suggests the existence of at least 5 additional red blood cell antigens in cats beyond the ABC system, with one possibly corresponding to the previously described MYC antigen. It is also important to consider that various disease states can uncommonly affect blood typing results in both humans and animals. For instance, in human patients with certain blood cancers, the loss of A and B antigens from red blood cells is a recognized phenomenon, potentially due to alterations in gene expression. A study in cats reported that some type of domestic short-haired cats with feline leukemia virus-related anemia were misclassified as AB type, possibly due to antigenic mimicry or a reduction in the enzyme activity responsible for converting new AC to new GC. The cat in this report was also positive for feline leukemia virus, leaving open the possibility that this viral infection could have influenced antigen expression and antibody levels. However, the cat's advanced chronic kidney disease ultimately led to euthanasia, preventing long-term follow-up to check for potential changes in its blood type phenotype. A recent large study found no significant association between overall retroviral status, FALV or FIV positive/negative, and blood type in cats. However, the number of cats with active FALV infection in that study was relatively small, which might have limited the power to detect such an association. Historically, the immunochromatographic strip assay used in this case has been reliable for detecting the ABC blood types in both anemic and non-anemic cats. Studies evaluating its accuracy have reported high sensitivity and specificity for identifying type A and B blood. Unfortunately, due to the owner's decision for euthanasia, it was not possible to collect fresh blood for repeat testing using alternative methods considered to be gold standards, such as traditional tube methods, gel column assays, flow cytometry, or other reagents like Triticum vulgaris lectin. In conclusion, this case of a domestic short-haired cat presented a unique combination of findings. The inability to determine the cat's ABC blood group using a standard in-clinic assay, coupled with the results of backtyping, major and minor cross-matching, and the genetic identification of a type B genotype, strongly resembles the exceedingly rare Bombay phenotype observed in the human ABO blood group system. However, further research is needed to identify if a similar precursor antigen to the human H antigen exists in cats. Alternatively, the possibility of an unusual weak B phenotype cannot be entirely ruled out. In such a scenario, the cat might have very low levels of B antigen on its red blood cells, making them undetectable by common typing kits, while still eliciting the production of both anti-A and anti-B antibodies. This case underscores the complexity of blood typing and the potential for rare and unexpected variations within the feline ABC blood group system. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.